Hi, I'm Mel Pickett, Chief Executive of Bradford Teaching Hospitals, and welcome to this week's update, which focuses on our partners. One of our priorities here at the Trust is to ensure that people treating our patients reflect the diverse community we serve here in Bradford. To help us achieve this, we're pleased to be working with Generation Medics. They're a multi-award-winning social enterprise whose online and face-to-face career support services are helping to inspire the next generation of healthcare professionals here in Bradford.
So my role from the innovation point of view is to help identify innovations that would benefit the Trust. So today Generation Medics are here. They came through the Clinical Entrepreneur Programme with the view of trying to support people who want to get into a career in healthcare.
Generation Medics is a multi-award-winning social enterprise. We support people from all social backgrounds to explore, strive towards and thrive in NHS and health and care roles. This event is the launch event for our partnership with Bradford Hospitals so that we can support residents across Bradford and Craven into roles within health and social care through our virtual healthcare academy.
We are an anchor organisation within Bradford, so it's very important that we do support the people in the local community so that they understand what we're doing and what job roles we have within our organisation.
I came from a background where my parents hadn't gone to university. I always wanted to be a doctor, but I just couldn't find the support that I needed. And what I found was, kind of fast forward 7 years, I qualify as a doctor and working at the University of Oxford, and I find there's lots of state schools across the country that just don't have the support to support their students. Generation Medics was founded as a grassroots organisation by healthcare professionals who've got lived experience of perhaps having additional barriers or challenges in their way to get roles that are like super valuable within the health and social care sector.
It's not that you have to have a medical background only to work in healthcare. You can come from many different roles, from organisational to front of house, etc. So there's a lot of different roles that people don't think of when it comes to healthcare.
Often when you speak to people about who works in health and social care, you might get doctor, nurse, paramedic, but there's over 350 different roles, both clinical and non-clinical, within health and social care. There are some fantastic people who live maybe just on the doorstep of hospitals who would never consider applying. They'd be amazing at improving patient care for people. So that's young carers, that's people who have volunteering experience, and just helping people understand they can transfer those skills into health and social care.
In Bradford, we have a lot of different ethnic groups, so we have a massive diversity amongst the people here, and it's important for us that we have that reflected in our workforce, not only to help them through their community, but also to serve the community.
Earlier, we spoke to the children and young people in the audience and said, actually, sometimes when you're 14, 15, you have no idea about the roles available.
I applied for a weekend job at Boots, and what they did is they trained me up as a pharmacy healthcare assistant. So I actually learnt loads of skills that were really useful when I was training to be a doctor.
I never knew the role that I have today was available, and we're really supporting those people who perhaps wouldn't otherwise get access to these opportunities. So I find it incredibly fulfilling, and I'm really blessed to have thousands of healthcare professionals who also believe in the mission and want to see it grow, like those in Bradford, and that's why this partnership exists.